since the recording started. Good morning, everyone, or good afternoon. Welcome to the IoT meeting today. Today, we're going to have a presentation on IoT sensors, data at scale. First, welcome to the ACT-IAC meeting. So we are doing a presentation on the community of interest for Internet of Things. We are going to have a chance to have two presenters with us today. The first one is Ms. Renee, who has worked with transportation technology and policy issues at multiple levels of government for over 15 years. She is the Senior Director of Transportation Policy at Hayden AI. And they have recently published a report on understanding AI in transportation with the Inno Center. Ms. Ray is also serving on the Innovative Public Transportation Service and Technologies Committee and the Intelligent Transportation System Committee with the National Academy of Science Transportation Research Board. And also with us, we have Mr. Dr. I think, Thomas Osborne, I see MD, yeah, doctor, who is the Director of the Veterans Affairs National Center for Collaborative Healthcare Innovation, and the Executive Director of the Veterans Affairs Convergence Center, VC2. His team try to deliver the most advanced healthcare solution to our veterans. And we are going to be having a conversation on the latest technology, 5G, cloud computing, sensor technology, wearables, and IoT in particular. My colleague, Robert Werman is here. He can give you a small introduction maybe about the ACT-IAC and our working group.
Hey, good morning, everybody. Good afternoon for those of us on the East Coast. So just wanted to thank you, Marshall. So I'm Robert Werman. I work at GSA in the Office of Government-Wide Policy, and I am the government chair for the Emerging Technology COI. Just wanted to give you a quick update. And for those that aren't familiar with the ET COI, today we're going to be hearing from the IoT Smart City, Smart Infrastructure Working Group, but do know that there are also other working groups that fall under the realm of emerging technology. We, of course, have one around artificial intelligence. We have another one around blockchain. We have one around DevSecOps. And then most recently in the past year, we also stood up a quantum knowledge group. So if any of those other areas are of interest to you, please reach out and don't hesitate to engage. They meet on a regular basis, and they all get together, both in the industry, academia, as well as government, to work on projects throughout the year and then come together in these monthly meetings to talk about their progress and special areas of interest, as it were. So that being said, and I won't be but maybe another minute before I hand it over to you guys, if I share this desktop to that end. The purpose of the COI writ large is, as I had said, to bring together folks from industry and academia and government to create a welcoming environment for people. It doesn't matter what your level of expertise is. If you see yourself as an expert in any one or even all of these areas, or if this is something that is beginning to interest you and you want to learn more and connect with people that have a similar passion as you do, we have a way to make a place for everybody. And so to that end, there are a number of folks that serve on the leadership team here. We do currently have a vacancy for the government vice chair position. And so if there's anybody that has an interest in that, also, please don't hesitate to reach out. Throughout the year, there are other leadership opportunities that happen, as with any group of people. We all get busy and pulled into other things over the course of the year. So when that happens, it's not uncommon for other opportunities to come up. And by the way, in terms of the scope of these working groups, we are not limited to those as well. So we just went through an annual plan process with ACT-IAC. And by the way, for those of you that helped with that, do know that we just received word that ACT-IAC has approved the COI's annual plan. So all of those projects that the working groups enumerated that they wanted to be working on, they will have the go-ahead to get started. And then at the COI level, we have a lot of interest in being able to look at our biggest priority as bringing this community together. There's over 1,000 people that are on the COI mailing list across all of the working groups. So you're going to see a lot more over the coming year to help connect the dots among the people that we have in the working group. So with that being said, the last piece that I would just update on is that Imagination ELC is coming up at the end of October, and the registration is open for that. So if this is something that you're interested in, this is the flagship event for everybody from ACT-IAC to get together. And so don't hesitate to look at that. I hear that the rooms are starting to go pretty quickly as we get closer to the actual event date. And it's Sunday through Tuesday. That's a great event if you haven't been there before. So that being said, I'm going to stop sharing my screen, and Sam Navarro, Don Levitt, and the rest of the IoT team, I will hand over the podium to you. Thank you, guys.
Well, thank you very much, Robert. Thank you, Marshall, for that awesome introduction. And we are excited and fired up to get this panel started. As Marshall alluded to, we have two incredible speakers, one from industry, one from government, to talk about the conversation around IoT, and not just IoT, but how are we leveraging a lot of these IoT solutions at scale to analyze the data and make the right decisions for the different verticals that we may be supporting. But I just want to kind of clearly mention, as we discussed, this engagement and this specific conversation is brought to you by ACT-IAC. And in the spirit of ACT-IAC, ACT, the American Council for Technology, and IAC, the Industry Advisory Council, this is a nonprofit organization, right? And we come together to accelerate modernization within government. And then secondly, under the leadership of the community of interest from Robert and Marshall of the emerging technology community of interest, we want to say thank you for giving us the opportunity to have this IoT discussion today. So we're going to go ahead and dive right in. We got a lot of content ready for you guys. And I'm going to go ahead and turn it over to our speakers here shortly. Renee Autumn Ray, who's the Senior Director for Transportation Policy at Hayden AI, will be speaking about IoT and IoT at scale from a transportation perspective. And then we've got Dr. Osborne, who is coming to us from the VA, Palo Alto, and his experience with IoT at scale from a medical perspective. So we're going to be bringing two verticals to you guys in this brief conversation. And we're going to try to then provide you guys 15 to 20 minutes at the very end. So I'm going to ask my ACT-IAC folks to keep me honest here. We want to make sure we open it up for Q&A and additional content from our speakers today. So Renee, I want to go ahead and get started with you in terms of just give us a quick intro. What are you doing within this space? What is Hayden AI doing within this space for transportation and transportation policy in perspective? And just give us a quick observation from your perspective on transportation and IoT.
Sure, absolutely. Thanks you guys for having me. I'm excited to be able to learn from this group and talk a little bit about the technology that Hayden AI is employing. So I was trained as an urban planner over 15 years ago, and most of my career when I was in government, a lot of what it focused on was trying something new. Sometimes it was a policy or a regulation, and increasingly it became a piece of technology, whether it was a website or some sort of software enhancement. And the reason that I came to work in technology full-time, frankly, was inheriting a technology product that didn't do what my leadership wanted to in terms of solving the problem. And I saw how much money was being spent in this industry. And as someone who, was trained with a very strong ethical framework for helping solve problems for the public good, I thought, let me get into this industry and see if I can help steer it towards the direction of creating really good technology. So I found my way to Hayden a couple of years ago, and I have just a couple of slides, so I'm going to share my screen. And one of the, I think, important things about technology is that the nature of technology for transportation, I think a lot of the data that you want to collect and analyze involves a piece of hardware to gather that initial data. So, I think a lot of the consumer technology products that are in the market can work with, cell phone data or with other third-party data sources. But a lot of times in transportation, if you think about the huge amount of public right-of-way, which can often be anywhere from 20 to 40% of the land use in a community, a lot of the data that you want to gather involves either humans gathering data manually, or frequently you use the data that you have because the process of gathering it manually is just, exponentially too expensive for you to try to attempt to gather. And so the product that Hayden AI came out with is something where we're enabling large metro transit agencies to keep the dedicated bus lanes and bus stops that they have invested in free from illegally parked vehicles. I'm going to show you the hardware just to give you a sense for what the IoT, in our case, what the sensor looks like. So you can see on the right there, it involves a perception engine because we process data on the edge. We have a number of, software algorithms and artificial intelligence that's powered on the machine itself. You can see a couple of different cameras, and what those do is enable us from our equipment inside a transit vehicle to face out into the public right-of-way and to not just gather data on what's occurring on these public right-of-ways, but also to interpret, to understand, and to capture small snippets of the data that's valuable. So rather than something where you have 16 hours of video that gets uploaded to the cloud at the end of the day, this equipment has the perception ability to figure out what is actually valuable to the public agency that has this need. And we're only collecting and storing that data. So it's already interpreting and providing something that's useful in the way that the agency needs it. There's a couple of other things like an antenna so that information can be shared in real time. And then something called a J1939 plug that enables us to get telematics from the vehicle as it moves through space because we have very precise localization. So I'm showing you several different pieces of hardware. I'm also going to show you, it's actually, for this audience, is probably not too complicated, but the framework in terms of, the moving pieces in terms of the software and the communication that's taking place, both with the equipment that Hayden AI provides, and then with how it needs to be shared with, with the transit agency, with a parking authority, or with a violation processor in the event that someone has parked illegally. And then I'm just going to show you a 19-second video of what our cameras are perceiving as they're traveling down the street. So if you think about everything that the eye could see as it's traveling down a roadway, basically what our technology does is interpret and collect only, I'd say 2 to 3 dozen discrete pieces of information that are actually relevant. So if we're talking about traffic enforcement for these bus lanes, you want to know, where is the lane? Where does something become a sidewalk? When, are these the hours of day that traffic enforcement is legal? Is the right day of the week? And so it's a combination of physical infrastructure and policy rules that a public agency has provided to us that enable our equipment to function at a really high accuracy. So that's just a little visual snippet of the use case that Hayden AI has provided, and the fact that we have to have a piece of hardware in order to do this work, right? And that's something that agencies have been interested in doing. They've been interested in their bus lanes actually being clear and letting people travel at the speed they want to, but it's something that you really could not do manually or with parking enforcement officers because of the cost of that. So that's my quick overview of our technology, and appreciate again the opportunity to chat with you guys today.
Thank you, Renee, for that. Connecting the entire stack from the hardware to software, and you're right, understanding the dynamics is imperative to make sure we keep people safe out there in terms of transportation. And Dr. Osborne, talking about keeping people not only safe, but healthy, I want to turn it over to you. You've gone from implementing private 5G networks into a hospital environment to now going far beyond that Tell us a little bit, quick intro about what you're doing within your space in VA Palo Alto.
Yeah, thanks so much, Sam. And Renee, really cool stuff that you're working on. And obviously, I think all of us working in the area of high tech and interoperability and sensors and AI are going to be finding ourselves working shoulder to shoulder. At least I think that we'll be more successful when we do. You know, that's where the next frontiers are going to happen, at the intersection of different people, tools, technologies, and perspectives. But to answer your question, thanks for letting me be here. And geez, our mission, our purpose, our goal is to provide the best, most advanced healthcare possible for our veterans. And we have a lot of tools that we use and a lot of collaborations we've established to get there. But really, the challenge I think that we all have is how do we deliver that? How do we implement things? How do we solve problems that people want and need addressed? And if we can do that, like, how do we do it at scale so we can positively impact the most people possible? And so that's the journey we're on. That's the sort of perspective we're taking. And the other really cool and exciting thing, I think, for all of us is technology. You know, thoughtfully implemented technology with all the right stakeholders at the table has the potential for great scalability. Of course, you know, in healthcare, the stakes are high, so you want to make sure you get it right. But the ability to scale solutions that have been proven to be successful, to impact many more people, to reduce costs, to increase efficiency, that's super exciting. And then when we can get all these different tools working together in harmony, interoperability, and maybe, you know, if we do it really well, we can talk about the Internet of Things and how all of these devices that are sometimes disconnected to come together and to talk to each other in ways that's harmonious. That I think is going to be really fantastic for everyone. We're starting to do that now, but there's so much more that we plan and want to do.
Well, thank you for that overview. And, you know, while we were talking prior to the conversation here, you know, part of our conversation went in around multimodal analysis and how we're moving the ball, but we're not quite there yet. But tell us a little bit about how VA is moving the ball in terms of 3D digital twin analysis of the facility and some of the use cases, incredible use cases that you talked to us that's kind of enabled within your space.
Thanks, Sam. This is really cool stuff that we're very excited about. And not just because it's cool tech, although it is, but because of the potential we have to possibly transform healthcare. And just as a sidebar, like, you know, we are working at the VA in the largest integrated healthcare system in the US. A lot of really amazing people in our facilities. And also we have this great mission to serve our veterans who are often willing to sacrifice so much for all of us. So it's a great mission. But the other thing, when we solve problems at the VA, you know, with such a diversity of people, then those solutions are likely going to be applicable to people outside of the VA and perhaps around the world. So super exciting. Now, so you asked the question about some of the cool stuff we're doing. I'll just sort of give some background. You know, in healthcare, we've done a great job at collecting data. Oftentimes they're in disconnected systems. And, you know, what we really want to do is turn data into information into knowledge, and knowledge into wisdom. And to do that, you know, we need to pull things together in ways that has never been done before. One of the ways that we can do that is use bigger pipes, because it's a lot of data. And so that's sort of where 5G comes in. We are the first full spectrum 5G hospital in the world. And with that allows us to do high band, mid band, low band, which is good for different things, and to allow different systems to pull together all these otherwise desperate data streams. You know, we got in the ICU setting, for example, we've got, you know, sensors and alarms going off all over the place. If all that data can come together in a meaningful way, then we can do some things like you mentioned, like multimodal analyses and maybe multimodal machine learning, where you're not just looking at one variable, but you're looking at a variable in context to another. So, you know, you've got, you know, the EKGs, you got the vital signs, you got the pulmonary stuff, you got the IV lines, you got the EHR data, you got genomics, all that stuff together will be profound. And we really need systems that talk to each other effectively to do that. One of the things that you mentioned, I think, is really cool. I'll try to share my screen here. Scrolling through, hang on a second. All right, I'm gonna share a bit of our website. So we just have a, just an early website here. So we're doing a lot of stuff. I'll just scroll through here with augmented reality, really cool 3-dimensional stuff we're doing. We've got sensors and sensor technologies and wearables. But you mentioned 3-dimensional, 3D digital twins. So, hospitals are not just, focused on taking care of patients. They're also focused on the infrastructure.
Oh, I think Dr. Osborne might be frozen.
Okay. I was wondering if I lost connectivity, but
No, yeah, I wondered the same thing.
okay.
Well, go ahead, Sam.
As we try to get Dr. Osborne up to speed here, Renee, talk to us also kind of within the spirit of, you have a large array of sensors, right, within transportation. And connected to that, we talked about different use cases. It's not just about keeping the law, but also keeping people safe. Talk to us about those use cases within transportation.
Sure, absolutely. I appreciated the point that Tom was making about the VA, and I suspect that most agencies are like this. I know it's certainly true for transit agencies. They're awash in data that is not necessarily helping them make better decisions easily. And so, frankly, what I have found interesting too is frequently the transit agencies are working with a large number of third-party vendors, and any level of data integration or compiling into single dashboards for stronger situational awareness is challenging at best where it happens at all. And so one of the things that Hayden has been able to do as we're sort of growing rapidly is start to provide our data in a format that's shareable with those agencies, additional vendor partners, and provide dashboards in a way that they can also integrate some of their additional third-party sources, so that the picture that they're seeing of real-time operations is more robust and a richer data set that is helpful for them as they're conducting their day-to-day business.
And how far away are we from extending this to the consumer, Renee, from your perspective? If you could give us any insight in terms of, we talked about one specific use case that I thought was fascinating to me, that was connected vehicle tech, and how vehicles can share information between one another and also keep people safe from that perspective.
Yeah. One thing that has been interesting to me, as someone who's been working in transportation technology for a few years, is there is a lot of interest on the part of public agencies to understand and in a lot of cases collaborate with autonomous vehicles and with connected vehicle technology. But that has been an area that is rife with a lot of challenges. So there's been this debate for, 4 to 5 years about something called the spectrum, which is a gigahertz frequency that US DOT wanted to reserve for connected vehicles, but that I think the FTC has felt has not been utilized effectively. And so that frankly is a years-long legal battle that I think makes it hard to view near-term opportunities for connected vehicle technology. And I will say too, one of the things that I think is not known as well is a lot of artificial intelligence capabilities are in the consumer space and they're provided to the public. And there is a pretty accurate sense that there has not been very strong regulation in terms of, how is this technology being used and how is my privacy as a consumer being protected? And so I think because of that, there's, of course, even greater concern from the public if you're talking about something like a government agency collecting data. The good news is we have decades of case law around data privacy and, where is there a right to privacy and what are the rights of, both private citizens and public agencies in public spaces. And so the challenges of regulating AI in consumer products, I think don't really translate very well into the public sector space because there's already a lot of other regulations. They may not be specific to artificial intelligence, but there are safeguards, there are regulations in place, there are policies that can help guide whether it's elected officials or, decision makers within public agencies to understand when is it appropriate to deploy technology. And I think too, what I have seen and what I have heard from my friends who work in the public sector is the real concern is if you as a human cede control of making a decision and give it to an artificial intelligence tool and assume no responsibility. I think that's just something that I'm not sure when that might ever happen, but it's nothing that I see happening anytime in the short to near term. So just to give you an example from the technology I shared earlier that Hayden AI does, there is enabling legislation for all automated traffic enforcement that a human must review a violation before the registered owner of the vehicle ever receives a ticket. So in that case, it's very clear that there is a human authority that is, has accountability for the decision to send out a traffic violation, for example. And I suspect that what you're going to see is a lot of artificial intelligence tools that help you do your job better and help you perform better, but where your job is still, your role as a human with, judgment and common sense and, accountability is something that's going to be even more important in the future as we figure out how these tools make sense to help us do our job and help government perform better.
Yeah, I like that idea in terms of, first and foremost, it was fascinating to me from a smart cities perspective that literally a car becomes a driving sensor, right? That can communicate information of whether there's a pothole or to other cars as well and help them avoid certain things within traffic that we don't have the capabilities today. And I think you're right, it's going to take time to get us there. But as we get there, there is this conversation of balancing the consumer's needs and then the government needs and then the regulation aspect of that. Can you talk to us a little bit in terms of, right, because a lot of these IoT products and solutions are really driven by the regulation, you're right, and that's kind of dynamic in a way, right? City council could change trafficking rules from one session to another. How does Hayden kind of facilitate that and incorporate that into the technology that's applied and some of the best practices you guys have been able to levy for that?
Yeah, absolutely. We are, especially as a young startup, we're about 3 to 4 years old, but I was employee 16 2 years ago, and we're now up to about 90 people. So we're growing, but we're still very small. So, as a young startup, we're absolutely guided by where is the technology that we perform enabled, because the nature of traffic enforcement in the United States is it's typically enabled by specific legislation rather than being something that's allowed by right. So that certainly is something that guides, what markets we pursue from a sales pipeline perspective.
So I want to see if we have Dr. Osborne on.
Yeah, absolutely.
Hey, I'm here. Sorry, I made the mistake of taking the call from home, and I don't know, they're doing something with the internet, but I'm on the phone, so thank you for your patience. I'm back.
No worries.
Welcome back.
Welcome back. Yeah, we're glad to have you. And I think you absolutely blew us away with the 3D imaging of the facility and that use case, and I think probably was too much for Zoom to handle. But why don't you back the platform here, Dr. Osborne, to kind of at least talk through it, right? An image is worth 1,000 words, but talk through it and some of the value you guys are giving patients and the facility with that specific use case.
Thanks. And again, thank you everyone for your patience, the errors of working from home. So there's so much we could talk about. And if you happen to have a link to our website, and maybe we could tag team this if you want, or I could just talk through it. So
Don Lovett, just for the record, Dr. Osborne, Don Lovett did bring it up, so we have it up for you.
Okay, awesome, thanks. So we'll just talk through. So there's a couple of different video links there. And if you go to the digital twin and you click on the one to the left, that was the one I was tempted to talk about. If you can just play that. And so basically, healthcare is complicated, right? And there's so much going on, and certainly with infrastructure. And so one of the things we did is we deployed an advanced drone program with our police department, our VA police department, and we made a three-dimensional data set, a digital twin of our facility. The drones took a bunch of pictures, we stitched together in this thing called a point cloud, and there it is. And so once you have this data, then you can manipulate it and adjust it in any way you want. And this video just is one way we flew through it for an example. But then once you have that data, then you can superimpose other elements onto it. And so if you were thinking, hey, let's build something in this space, or put a park there, or a garden, or whatever it is, you can plan it out, especially big buildings. You want to plan that out to make sure that the flow is correct, that there's not blocking anything, that you're meeting code standards and everything else. And that's a lot cheaper. But the other thing that's cool, in situations of emergencies, is you can literally get everyone on the same page. And so we can take this information, or just drone data, and we have drones in the air that have really advanced tools and technologies. And these drones are connected through our 5G and also to the edge. And we can leverage artificial intelligence, computer vision technology to pick things out of the crowd, whether it's a fire and you want to find the best way to evacuate people, or label buildings so first responders know exactly what they're talking about and going to the right place. Or maybe you have something called patient elopement, where a patient gets, is wandering and walks further than they should, and they're missing from, where they should be. This happens all over in many different hospitals. And if someone happens to be cognitively impaired and dementia, and they wander, the last thing you want them to do, especially, in a cold day, is, find themselves where no one knows where they are and they're lost, or walking towards traffic. So having this type of technology where you can quickly scan an area, either with a model or with overlay or real time, and have that data accessible to first responders as well as a command center, and be able to pick out of the crowd someone who meets the criteria, maybe a green Johnny and a red hat or whatever, and quickly find that person. And we've done some initial assessments, and we did a head-to-head comparison, so to speak, of how to do this search in the traditional way with the scanning the system with canines, and then what's the speed that we do in comparison to when we use these advanced technologies. And it was tremendous, and we're planning to publish that, so I won't spoil the news, but it was significantly faster. And time in these situations is really important, and obviously time can mean people's lives in any kind of emergency. And then there's so many other things we could talk about. So you talked about the digital twin, and if you have the website up, we're going to scroll down to virtual teleportation near the end. And in this, we created a proof of concept, an MVP, and we used some advanced technologies that we had, and I can get into that if you want, but we've been able to take a real-time virtual capture of, in this case, myself, who was in a different room, and teleport that into a patient's room. And the implications for this are really profound. We were doing this for kind of isolated patients or with that use case. I mean, imagine you got COVID and, before the vaccines and everyone was trying to figure out what's going on, or even now you got some hospital acquired, infection, or you got an antibiotic resistant bacteria or TB. You want to connect with people, but you're isolated. I mean, that's awful. And being able to use this technology to bring people virtually into the room, like the Star Wars kind of thing, is really profound. And the idea that we can do that, and not only in the hospital setting, but maybe at home, and integrate that with other tools, other sensors, vital signs monitors, wearables, you got this whole idea of a quantified self, and be able to provide advanced level of telehealth and do things that we could never do before, and allow people not only to get care from home and save the drive and the hassle and the exposure, but also be safer at home, especially someone who wants to age in place. Everybody that I know would prefer to stay in their home instead of going to a nursing home. Many people would. And so this allows people to not only connect with their doctors, but to other people, and to be in an environment that they're comfortable with and that they enjoy. Okay, one last example before the internet breaks on me. There's so much going on with multimodal analyses, and we've done one recently with climate, and we use both EHR healthcare data, data that was provided, high-level ICD-10 codes from CMS that we collaborated with, or CDC that we collaborated with, and also climate data from NOAA and NASA and other places. And we brought all those different things together to do a retrospective assessment to see who's at greatest risk for heat-related illnesses. Now, we just published that paper, and that is an important topic and an important assessment to understand who's at greatest risk. But the next frontier is to bring that information together real time, so you can have real-time flags and alerts, so you know exactly who needs intervention and care at the right time, at the right place, so we can prevent crisis from happening. There's so much more to talk about, but I'll stop there.
Those were fascinating use cases, from climate to facility decision-making to patient care, really covering the gamut of ways that we can leverage IoT solutions, and then have the pipes that allow us to transit that information to make the analysis and the decisions made. I want to kind of levy on something before we transition here to Q&A, and kind of roll it over to Renee in terms of something you brought up, Dr. Osborne, which is every organization wants to know what's the expense, right? But as you highlighted, sometimes we miss out on, well, what's the cost savings opportunity, right? And actually leveraging the technology. I like your use case of now, instead of making a change to a facility without having to pull permits and go through all of the design elements there's minimal to low cost in having a virtual rendering of that capability. And Renee, I want to turn it over to you. What's the cost savings? What's the value proposition right now, instead of potentially having a human having to make an analysis on what's the right transportation rule or law here for this thing or that thing or another? Technology is kind of enabling us to do that in a more efficient, effective way. What are some of the value props that you guys have seen the technology, embracing the technology, has enabled government to achieve?
That's a great question, and certainly one that every public agency needs to be asking when they're considering procuring anything, including technology. I would say the primary value proposition that we hear when we talk to agencies is, if you live in a major urban area, you may have seen your transit agency recently investing in dedicated bus lanes. And unfortunately, there's a famous example of a large city in the Midwest that rolled out some dedicated lanes and basically did not see any improved operational performance of their bus rapid transit, because so many people were illegally parking in the bus lane that it was continuing to weave in and out of traffic. And one of the primary ways that transit agencies measure performance is obviously on-time performance, and it's the speed at which the buses travel. So if you look at a city like New York City, and most urban areas that are putting in these dedicated bus lanes have a lot of congestion, you're talking about a bus that may travel at 5 or 6 or 7 miles an hour. And so if you think about the climate goals that a city may have in terms of wanting to encourage people to use modes besides, driving their own personal vehicle alone into a city, it's hard to make a case for transit being an attractive alternative to driving if you're going 5 miles an hour. And so what we have seen, or what our flagship client MTA in New York has seen, is a 9% increase in speed for the buses. And 9% may not sound like a very large number, but the important thing about transit agencies is that you're talking about scale. So this is a bus line that has 500,000 trips a month. So if you think about the thousands and thousands of people who are riding on that bus and who are getting time back in their day, you're saving them time, you're allowing them to do something more pleasurable than sit on the bus. And we've also seen some data that more folks are choosing the bus as an option because the experience is a better experience. It's faster, it's more on time. And actually, we found that bus operators also appreciate it because they don't like weaving in and out of traffic any more than the bus riders do. So that's one example. I also noticed someone in the chat mentioned the Federal Aviation Authority in another in an unrelated comment. But I recently published a white paper with the ENO Center that you mentioned, and it was about it was a plain language description of artificial intelligence methods and ways in which they might be used in transportation. And the best example I've seen is something that was proposed by the Federal Aviation Administration, which is basically developing or leveraging a large language model to comb through the thousands and thousands of pages of regulations that are required to safely operate in an airspace, and to interpret what's actually valuable for a specific need that an agency or an airline has. And in the transportation side, NEPA, the National Environmental Protection Act from the 1970s, is something that is important and was passed for a really valuable reason, which is protecting the environment. But what we have, today, 50 years later, is millions and millions of dollars that are spent on consultants to handle the paperwork to get through a NEPA compliance process. And I think that leveraging artificial intelligence to greatly streamline and reduce and speed up the time to compliance and the amount of human hours needed to ensure that you are compliant would be an extremely valuable and money-saving use of that technology within the transportation space.
I love that, Renee, and thank you very much for that input. It so resonated with me. We can save you money, but most importantly, we can save your citizens time, right? By leveraging the technology to do the right analysis and make sure that folks get home on time for dinner, right? Dinner is the most important time in my family, and I know it is for a lot of American families out there. So thank you very much. With that being said, we're going to open it up for Q&A. So I'm going to return it back to our MC, Marshall, to take over the Q&A session for Dr. Osborne and Renee. And I just want to say, Renee and Dr. Osborne, thank you for taking time out of your schedules to kind of share with us what you guys are doing in this space. And it's been really an honor for me to moderate for this period of time, but thank you very much for taking the opportunity to share.
Thanks so much.
All right, well, thank you. Thank you both. It was a really good opportunity to learn a few things. I actually went to the Hayden.ai website. I have a few questions about the inference, in particular related to finding the street corners.
You can go ahead, but I will say I'm not an engineer, so I'm a little scared.
Okay. Yeah, no, I looked at it. I was like, oh, the video looks interesting. And then I was like, oh, hey, there is dots for street corners. So is it the GPS based or is it actually because it's hidden by cars? Anyhow.
Oh, no, I might be able to handle that one. I can tell you that basically our technology was originally developed for an autonomous vehicle purpose. And so it uses something called SLAM, which is simultaneous localization and mapping. And so basically a combination of this SLAM localization and the cameras that we have, and the fact that, we map out a route and, drive it again and again on the bus, and we note anomalies or changes over time, right? Because the illegally parked vehicle is an anomaly. But basically, the cameras and the AI allow us to get 0.5 meter accuracy. And so basically the antenna that we have on the top of the bus uses, depending on what signal is the strongest, GPS or sometimes GNSS. And I think there might be a third, but I'm not sure I can say it or that I remember what it is. So I'm gonna leave it at that.
It's okay. It's already very much appreciated. I was also wondering the type of hardware that run that. I'm thinking a NVIDIA Jetson, but I might be wrong.
It is. We've got a couple of different, it's definitely NVIDIA. I know we have the Jetson now, and we're looking at some of the new chips, but you're probably familiar with the chip shortage and everyone, scrambling to try to get the newest and latest. But yes, it's NVIDIA.
Thank you.
So this is Don Marshall. I had a question that really kind of crosses the two domains.
Please.
So if you think about a bus driver that has a wearable that is monitoring, various health indications, and that information could easily be transmitted back over 5G to some of the either expert humans or expert systems back in the Palo Alto Veterans Facility. You can also combine that with some public data around weather forecasting or satellite data from, expected showers or snowstorms or whatever. So really, do you see bringing those kind of multifaceted, multi-domain data sets together to really try to achieve better public safety?
I'll jump in. That's a fantastic idea, and I 100% agree with what you're saying. That is one of the visions that many people have. So, to your point, you might have someone that's got, a smart watch or a wearable that's collecting real-time data, and something's going on in the environment where that particular person, based on their history and their comorbidities and the environment that they're exposed to, puts them at a different type of risk than somebody else. And there's an important need to alert a system. And so the architecture, I think for that is basically you have two things. You have the connectivity, which could be, any kind of connectivity that's wireless, but 5G does give you the ability to move more information. And then you'd have a central hub for the data like edge cloud computing. And so the edge would have different compartmentalized areas for HIPAA compliance. And that would have both personalized health information that would be in one enclave. And then you would also have other data from the environment, whether, it's sensors of, what's down the street or what's, remote sensing from satellites. All that information can come together and be processed on the edge with advanced analytics, probably in some form of AI, that would be able to both real-time process based on the model that was already created, and then give that information back to a first responder or to a network of people who can address that. And so in that situation, the cloud or the edge would be the hub, and you'd have all these spokes coming out, which is the connectivity and the sensors and the people.
Very nice.
Frankly, I don't think I can add anything to that, Tom. That was really interesting. Thank you.
And obviously, we want to open the floor also to other questions. So if you have a question, please let us know. Okay, well, if nobody has a question, I'll actually ask a question. Dr. Osborne, I was wondering, you have a lot of interaction. It's not entirely about the digital twins, but it's also about the integration, about VR technology inside some of that component. And I'm wondering if there is a path forward to reach that. I know VR is a special field, right? But I was just wondering if there was a path forward there.
That's a fantastic question. So I think I can answer two questions with that, but I'll need to sort of set the stage. So the XR is sort of this big category, which includes augmented reality and virtual reality. We're doing stuff in both. So a lot of the work we're doing that involves connection to our healthcare systems infrastructure is in the augmented reality space. And augmented reality and virtual reality, they're very similar, except virtual reality tends to be completely immersive. It's a total digital view, where augmented reality, you kind of see everything like it normally is, but something virtual is superimposed upon that. And so if you're doing, if you're a radiologist like myself and you're looking at advanced imaging and sometimes someone's CT scan, it comes across in ways it's not super intuitive, but we can use the information that we have in the edge to transform those two-dimensional flat images into a three-dimensional hologram that then you can manipulate, and then you can find a more intuitive best path to the disease or the process that you want to solve or take care of. And so that's really profound in and of itself. But then you can take it the next stage, which we recently have, and you can take that three-dimensional hologram of someone's own CT scan or MRI, you transform it into sort of this unintuitive thing to a three-dimensional thing. You can take that and you can superimpose that CT scan of yourself onto your own body and register it. And when that happens, you have three-dimensional X-ray vision, which is super crazy and very cool. And so that's important both for sort of diagnostics and teaching and education. But once you're able to do that, then you can do things that we've only dreamed about before. Because if you have someone's CT scan that's superimposed on their body and you have three-dimensional X-ray vision, now you can do procedures with visual guidance and great precision that you would never be able to do before. A lot of procedures that we do in healthcare are bedside procedures where we use landmarks and we do our best to find the right path. But with this, you could actually see with tremendous precision exactly where the needle is going or exactly the best path to cut through, avoid the arteries and nerves that you want to avoid and get to the right place. So that's sort of one part of the question. So all that has to connect, both to our healthcare database for imaging, which is PACS, and other things like our EHR that has patient information in the network. But there's another thing. We talked about ROI earlier. That's such a great question. There's sort of three costs potentially. There's the direct cost of the tools and the savings that comes out of it, or the value that you can save or bring out of that direct cost. You got indirect costs, which are also often downstream. And then you've got achieving the mission of what you want to do. And in healthcare, there's an ethical cost to this, doing the right thing. But one of the things we did early on is we had our employees try out this advanced augmented reality system that we had. And we asked them what they thought about working and their intent to stay working at the facility. We asked them all these sort of structured questions before they tried out that system. And then we had them try it for a little while, for about 10 to 15 minutes. And then we asked them those same questions afterwards. And what was really profound is that our results sort of changed the common understanding or narrative, where people people in healthcare don't want to adopt technology. What we found is that actually narrative that's untrue. People were excited. People wanted to do more. They thought about all these use cases. And in fact, people were more likely to not only be more excited about their facility, think about it in higher regard, but more likely to stay. And recruitment and retention is a very big deal anywhere, but in healthcare, it takes so long to credential and to train people and to get them used to the system. Losing an employee who is a clinician, whether a nurse or a doctor, has a tremendous cost associated with it. And to be able to show that just using this advanced technology can keep people at our facility and more likely and engaged and empowered and excited about working there has its own cost, which is the expense of having to train a new employee. Not to mention the fact that when you have a lot of turnover, that's not great for patient care either. So there's a lot of like direct, expected and unexpected effects and consequences of the work that we're doing.
Yes, sir. Actually, you reminded me of something important, which is train the trainer, right? Training the next generation of surgeons in particular is a great topic of conversation with augmented and virtual reality. We are running close to time. Sorry, please go ahead.
No, I just was agreeing with you, and we can do this stuff at a distance too. You can have people that are in different parts of the country or the world that are all in the virtual same space and talking to each other and working on the same virtual hologram, for example, or other things. Very profound.
Very well. Thank you. We are running about 2 minutes to the end of the conversation. I know, I know we have to try to end on time. So if there is any last minute question, please come forward. If not, first, thank you everyone for joining us. Thank you for attending the meeting. And in particular, Dr. Osborne, Ms. Ray, thank you so much for taking the time to talking with us. Really riveting conversation. I have a ton of notes.
Thank you guys so much. This was great. I really appreciate learning from Tom and getting to participate and share what Hayden AI is doing.
I agree. Thank you, Renee. Appreciate the work you're doing as well. Very exciting.
And everybody's information should be on the ACT-IAC website for people who want to try to follow up. I see Robert. Actually, go ahead, Robert.
Oh, hey, thanks, Marshall. Thanks everybody for joining. I just put a quick plug there in the chat for those whose emerging tech appetites haven't been, it's like they have like unlimitless emerging tech appetite. There's actually a pretty neat summit going on today downtown. Eric Schmidt and Jensen Huang, the CEO of NVIDIA, are there speaking. It's going to run until 6 o'clock. You can stream it at any time this afternoon using the link I just posted for what it's worth. Thanks, guys.
Super sweet. All right. Don, Sam.
Thank you for the
Thanks
opportunity, everyone. Have a wonderful day.
Thanks all.
Thank you.